Welcome back. This is Dr. Kaan of the ACL Academy. I'm dropping a new YouTube video on a question I get a lot after an athlete or one of our clients finishes their quote unquote ACL journey, is back to their sports, is back to their activities, and getting back to the things that they love. And the question is, well, what do I do now? Do I have to continue anything? Should I go for checkups? Should I continue some of my rehab exercises? What do I have to do? Before I get further into that, please guys, if you found some value out of this channel, subscribe to it. If you find value out of this video, please like it. And of course, you get some questions, drop them below. We get to basically every single one. And most importantly, if you have a fellow friend, colleague, teammate, fellow ACLer who can benefit from the tips and education we put out here weekly, please share the channel with them. So getting right into it, question that we get a lot once our clients graduate and are back to their sports, back to their activities, feeling good and confident is, well, do I have to do anything now? Do I have to worry about anything now? Do I have to worry about re-injuries? Do I have to worry about arthritis? What can I do to prevent any of this stuff? So a couple hard truths to this. One is, if you sustain an injury like this, unfortunately, it does put you in a higher risk category for sustaining another one. That is just a plain and simple fact. And that goes for any injury. If you sustain an ankle sprain, it does put you in a higher category from anybody else to sustain another one down the road. So when you do suffer an ACL tear, fortunately, it does put you in a higher risk category to injure that same knee or the opposite knee, especially if you're getting back to high level sports. Second hard truth is arthritis. It does expose you to a higher chance or higher occurrence for getting arthritis in that knee down the road. And that is regardless if you get your ACL reconstructed or not. Unfortunately, when you sustain an ACL tear, you are also in a higher risk category to get arthritis in that specific joint itself. So what can we do? Number one, what I want to share with all of you is, if you get an injury like this, you have sports, activities, you're an active person, you want to be an active lifestyle, don't hold back. There's no reason for you to stop these things. You don't get ACL surgery to be a shell of yourself. You get a surgery like this to be back. Yes, your knee is going to go through some changes structurally. Yes, it's going to require a lot of work on your end to get back to feeling comfortable and confident 100%. But at the same time, an injury like this should not prevent you from being back to exactly who you are, getting back to those sports and enjoying your life again. As far as what you should do and continue to do after your ACL journey is over and you reach the destination and you're back and you're feeling confident again, is you need to continue on some sort of capacity with strength work. Number one, if you're not a gym person, if you don't like being in the gym, if you don't like lifting weights, you know that this process, in order to be completed, took a lot of gym work, took a lot of strengthening, made your legs stronger than ever before. It's important that you keep leg strengthening in your repertoire. It's important that you keep that in your weekly routine. Usually a recommendation is twice a week where you should be strengthening the legs. The stronger we can keep the muscles around the knee joint, particularly the muscles, talking about the quads, the hamstrings, the glutes, small muscles in the calf. These are things that are going to help provide stability, provide support, and also help being and putting through our body to the demands of that sport. So it may not be at the same volume as you were doing during your ACL recovery process. At the same time, it has to be a staple in your routine, especially if you're continuing, as I said, any type of sport that is demanding on the knee. It doesn't have to take over your life. We're talking about twice a week, 30 to 45 minutes focusing on those muscle groups. Super important. Number two, as our clients know, we test strength monthly throughout your ACL rehab process. What I would urge you, especially in the subsequent years following your rehab, year 1, year 2, year 3, be a good idea to maintain doing some type of objective test on a routine basis. And this doesn't have to be monthly like we would do in your ACL recovery process, but you should test your strength every 6 months or so, just to get an idea as well. Okay, how do my legs match up with each other? How does my strength match up to my overall body weight? So usually muscle groups that we like to check are definitely the quads and hamstrings. And then it'd be a good idea to know what you can squat, for example, what you can deadlift, for example, and you want to be able to compare that. Okay, these are good numbers. There's normative values. Are these good numbers for my height and my body weight? So this way, if, let's say, something happens in your personal life, it gets very busy and you miss a bout of strengthening for a month or whatever, maybe you get sick and you're out of the gym for a few weeks. So it's important that you number one, get back on your routine, but number two, if you do some testing along the way, at least you'll know what your numbers look like, how your legs match up with each other, how your legs match up strength-wise to your body weight. And then this will tell you, okay, if you're a little low, you know what to work towards. So these are very, very important things that you do maintain some strength work even when you're all said and done, as well as do your strength testing periodically to make sure the numbers aren't falling too low. And if they are, you know where to put in the work. So that's number one. And when we're talking about, so what does this help with? Number one, with re-injury rates, especially for those that are getting back to high-level sports, it can be anywhere from, as reported in the data, some reports 10%, but they're as high as 30%, especially if you're getting back to a high-level cutting, pivoting type sport, and there's a high volume of it, right, per week. So you're playing, let's say, 3 times a week, 4 times a week, or 5 to 10 hours per week. These are things where you're being exposed. So it's important that you do keep up with this strength. Number two, on the arthritis end, right, I did talk about how if you do experience an injury like this, it does put you in a higher risk category for having arthritis down the road. Well, strengthening doesn't necessarily prevent arthritis, but what it can help is stability and the support. The stronger you are, can offload the joints. It can take away pain or minimize pain. So that's another area where, again, strength work is going to help. So this is something that I really, really do focus on. You're going to pick up some good principles during your rehab process. You're going to pick up a nice routine during the rehab process. Don't let it fall to the wayside. This is not, what we share with our clients is this is not a death sentence. It's important that you learn these principles and you keep them with you throughout your life, especially if you want to maintain an active lifestyle, especially if you want to maintain longevity in the knee joint itself. If you guys have some questions, drop them below here. If not, I will see you here next time. I drop a video every week on our ACL Academy channel. Usually Mondays they drop, Monday mornings. If you guys have found some value out of these videos, please please subscribe to our channel. And of course, more importantly, if you have a friend, colleague, teammate who's experienced an ACL tear, please share with them as we put out tips and education here weekly. See you next time. This is Dr. Kaan signing off.